With me now is Mark Lauder, Director of Strategic Communications for the Trump 2020 campaign. Mark, good to see you.
Good to see you, Katie.
So is this the issue you want to be running on in 2020?
Well, I think it's been something that the president's talked about since the 2016 campaign, that we need to eliminate Obamacare and the rising premiums, high deductibles, and then doing something about the overwhelming cost of prescription drugs. A lot of the action they've taken so far has been on the regulatory side with administrative action. If we can get the courts to continue through this process and eliminate Obamacare, I think there's an opportunity to come up with a great plan that could get through both chambers of Congress.
You're right. Donald Trump did run on it in 2015 and 2016. Republicans have been running on it since 2010, the year that it was passed into law. They've tried over 70 times, about 70 times, to repeal it. Still no plan to replace it. With no plan in the last 2 years, are you sure this is the issue that Donald Trump's going to want to run on, specifically because he ran on it in 2016 and nothing happened?
Well, we came one vote short in the Senate of getting something done, so it got very close. This is an opportunity. You obviously heard the president say today he's going to task a number of Senate leaders, including governors like Rick Scott and people who have experience in this, or former Governor Rick Scott, who have experience dealing with state plans and state associations, because so much of this is done at the state level. So this is an opportunity to bring his expertise to bear, along with some of the other great health care leaders in the Senate. Let's see what they can come up with. He said, though, we do have some time here. We're going to go through this appeal court process. It will no doubt go to the United States Supreme Court, and that will put the deadline on Congress to get something done.
Why is the president not leading the way on this issue? Why is he not coming up with a plan that he's going to ask his Republican lawmakers to get behind?
Well, I think he is leading by laying out the parameters. He's been very clear. We will deal with.
He was very clear.
Protect.
Hold on. He was very clear in 2017 and 2018, 2019. He's been very clear now for many years, and Republicans still didn't pass anything. And now Democrats control the House. So why does he feel suddenly it's going to be a winning issue, a better issue for him in 2020?
Well, I think if we can come up with a plan that's going to lower premiums, lower high deductibles, and provide better access to Americans out there, what we've already seen through what the president has done administratively, we saw the first drop in prescription drug prices on average in 46 years. So they're doing things like opening up association health care plans so small companies can pool their resources together and lower costs, provide better coverage to their employees. So there are so many things that they're already doing. If we can build off of that success, then we should be able to deliver a great health care system to cover those who are uninsured and who would be eventually phasing out of the Obamacare system.
A lot of good words, a lot of good promises. So we've seen no action, though, from the Republicans. And when you look at 2018 and how Democrats ran on health care and took back the House in a landslide, aren't you a little bit nervous?
Not really, because at the same time, you've got Democrats out there trying to scare people incorrectly about Republicans wanting not to cover people with pre-existing conditions. You have the Democrats.
All the
and many
legislation that the Republicans proposed did not cover people with pre-existing conditions, or if it said it did, it didn't. It allowed for premiums that could skyrocket, basically making that coverage for pre-existing conditions unaffordable.
And many people under the current Obamacare system, if they're not getting subsidies with pre-existing conditions, they have seen their premiums skyrocket.
Only 2 to 5% have seen their premiums skyrocket. 105% is a number that Mark Short claimed yesterday between 2013 and 2017. That's 2 to 5%. The rest are being subsidized. The rest have Medicare or Medicaid, or they have private insurance. 2 to 5% is a really small number. Why not focus on working within the parameters of what already exists to lower those premiums for that small number of people instead of gutting it entirely and kicking 20 million people off of their health care plans?
Well, I'm not a health care expert, so I can't get into some of the finer points, but we know we can do this through the private system. And while you do have Democrats trying to scare people about pre-existing conditions, Democrats are actually out there saying they want to take 180 million people's private health care insurance away and just give them some government health care card. I don't like going to the DMV.
Some Democrats are saying that. Not all the Democrats running.
Many of the leading candidates for president are saying that. and I don't like going to the DMV and waiting in line. Why would I want to go and wait in line to have some government bureaucrat deal my health and make my health insurance decisions?
The fact of the matter remains, there is a health care system in place that Democrats passed in 2010. Republicans have run repeatedly on repealing it and replacing it, and still in 2019, there is no plan to replace it. So when you say to voters, hey, listen, trust us, we're going to have a great plan, and you have nothing to show for it, I don't understand why you expect to get that trust back, especially after what you saw in 2018 with what happened in the House.
Well, I think we came one vote short from getting it done. I think they can build on that. They can use some of the expertise. They can get there. We have a larger majority in the Senate now than we did back then. So I think we can get something through the United States Senate.
But
and
you
then
don't
let's
have
see
the
if
House.
we can work with
You do not have the House.
the House. Let's work with the House. If the Senate can pass something and you have a deadline now facing the Congress because the Supreme Court has eliminated Obamacare, then there's a deadline for Congress to act. And as you and I both know, Katie, things in Washington usually get done when Congress faces a deadline.
What do you say?
This would be a deadline.
What do you say to Senator Susan Collins, who's not happy about this, or Senator Murkowski, who did not vote for the Republican plan?
I would say work with us to see what we can do to find a way to get a plan that can get your vote. I would also say that we have a larger majority now than we did back in 2018 when Senator Collins, Murkowski, and then ultimately Senator McCain voted against it. There will be areas to work together. Let's see if Republicans can come together and do it.
The plan that Republicans put forward that you said only lost by one vote, is that a plan that you would be standing by today? Is that a plan that you think adequately protects pre-existing conditions?
Well, I'll let the White House weigh in on the policy side since I'm with the campaign, and let actually Congress work through these issues. That's what they're tasked to do. The president's laid out the parameters. He's made it very clear he will not sign a bill that does not protect people with pre-existing conditions. So let's see what Congress can do now.
Mark Lauder. Mark, thank you so much for joining us.
Thanks,
we appreciate
Katie.
it.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Beat the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.